Thank you, Phoebe. I hope everyone can hear me okay. Just send a message if there's any issues with viewing the slides or being able to hear me. So I'll move on. We've got a presentation which will probably be in the region of about 20 minutes, depending on how fast I talk. And then we'll move on to it already with the laser setup ready to go here on the console table. And we've got a little dog, Rosie, who will be assessing later on for having a look at her elbows and really using her as a demonstration to show you where we look for pain and trigger points in and around her legs. So I'm Caroline, I'm a small animal vet and have been for too many years to think about. And I've been using the laser in practice for the last 2 years. I've used it for a wide variety of conditions, wound repairs, otitis, skin conditions, more recently for internal treatments, so for COPD or for cystitis, but obviously this talk is going to concentrate on elbow arthritis, but it's relevant to arthritis in all different joints as well. So we'll go through and obviously we'll start off with showing you how laser can fit into the multimodal approach to treating osteoarthritis and show you that there is huge amounts of evidence building all the time of the evidence of benefits. We'll go through what you want to look for when you're assessing the animal and doing your musculoskeletal assessment, but particularly looking for myofascial trigger points, because that's where the MLS really comes into its own with treating pain associated with the muscles. Particularly with the MLS, if you're already using it, you know you can use it in point mode. You don't have to keep moving it around. So when there's a painful spot associated with the trigger point, it's really effective at treating it. We'll go through protocols on the presentation on acute disease and chronic disease, and then we'll have the practical demonstration afterwards. So what is low-level light therapy, or more recently known as photobiomodulation? So using the MLS Class 4 laser, you'll find that it's a painful, non-invasive, non-toxic treatment. It's easily delivered in first opinion practice by either a vet or RVN or a suitably trained person who knows about certain risks that need to be prevented. It accelerates healing, provides analgesia and decreases inflammation with no side effects. There's 2 wavelengths in the MLS laser, and these are pulsed so that there's no issue with overheating the tissues. It's been patented to reduce pain, swelling, inflammation. The main mechanisms it does this is by photostimulation of the cytochrome C enzyme within the mitochondria, and that leads to a number of different changes within the cell. There's a huge amount of information on our website about this if you want to go into the science of it in a little bit more detail. But briefly, it includes increasing nitric oxide, which increases angiogenesis and vasodilation, helping with reducing swelling. It also increases ATP energy for cell repair and increases fibroblasts by producing the cytochrome C oxidase enzyme. And there's also evidence that it increases reactive oxygen species, which is important in improving endogenous antioxidant pathways, and finally reducing inflammatory cytokines, interleukin 1, interleukin 6, necrosis factor alpha, and reduced COX-2 mRNA expression. If anyone has come in just late and they've missed the start, we've only just had a few slides, there will be a recording at the end of the presentation, so you can go back over anything you might have missed. And as well, if there's any references, they'll be available there as well as the slides at a later date. So informed consent, obviously, for any procedure that we do in veterinary practice, we should have informed consent of what the indications are. Less important now when, in general, I know we're not having any owners in the practice now, so it's going to be the handler is going to be a staff member, and both the staff member, the person assisting, and the patient and the user. Ideally, the patient should have eye protection as well. And the main reason is I tend to keep my laser ready there. So we've got, it's turned on and ready to go. It's not actually on at the moment, but that's safe to have in the room without people with eye protection. But obviously, as soon as you turn it on, ready to use, you want to be aware of reflection happening on surfaces, particularly metal surfaces around the room. If there's any scatter, any leads or colours should be removed. But actually, in general, with the current guidelines, we're removing most colours before we see the animal in practice in any case, and have soft colours that we can use instead. Obviously, there are contraindications for use over any neoplastic tissue, any hormonal tissue like the thyroid glands, and if the patient is pregnant. But those are the, obviously you'll get, you would have had further safety guidelines on the purchase of the machine as well. And importantly, it is worth just going back to and thinking about positioning for both the patient and yourselves, rather than bending over, having the animal on the table if that's suitable, or a soft bed or a soft cushion for you to sit on. If this is something that you're going to be doing regularly several times a day, you want to keep yourself comfortable. So in terms of the using laser in the multimodal approach to osteoarthritis, we'll just talk about a little bit about what happens first. And what tends to happen is you get, the owner might not always recognise it as arthritis, but they will see perhaps a little bit of weakness. The dog can't jump up into the car anymore, or just struggles to go down certain steps. You'll get the start of lack of use of the joint, and eventually there'll be a reduction in the ability of the dog to get around and do what it normally wants to do, or the cat for that matter. The cat might not be able to jump up and jump onto the sofa anymore. There's a wealth of information online about starting to improve at a very early stage of arthritis management on the Canine Arthritis website. It might well be that you'll get a request from the owner that they can start hydrotherapy. Hopefully you'd recognise that if weight gain is an issue, you'll get them on a weight loss program. They might start supplements, owner education, and this is often the stage that you can actually implement some laser therapy, maybe to help with joint mobility and control the early signs of pain, which often the owner doesn't necessarily recognise as acutely painful at that stage. What tends to happen is the owner has gone down that route, they'll come into the clinic, or perhaps see them as an aside, they'll be there for a booster. Even more so now when we're seeing them getting out of the car in the car park, we'll see that they're struggling to get out of the car, and we'll suggest painkillers, and then each year we might add another type of painkiller. I would argue that actually, rather than reaching just for the painkillers straight away, you could actually start treating certainly muscle pain and pain around certain joints with the laser, and that will hopefully help prevent the progression of the disease, to try and reduce the need for long-term drug medication as long as possible. So that's what the MLS laser will be really helpful for. You can, obviously, we don't necessarily want interaction with the public and clients at the moment, but by offering a treatment that you can do in the practice, it will continue to continue the footfall, improve that client loyalty, and hopefully improve the outcome for your patients, as well as continue to generate practice revenue. The clinics can be offered by your RVNs, and then with regular vet checks. There's often very little need for the client to then come into the practice. They can drop the animal off and then pick up later at a later time. So in general, we've got these pulsed emissions that help prevent any thermal damage, which isn't the same for all lasers. It also helps, because you've got that targeted treatment, it helps with the penetration and limits the amount of time. So both you can treat the muscles and the pain within the joint. And in general, the expectation is that you can maximise results within about 6 treatments. So you can tend to reduce pain in about 2 visits. The inflammation is reduced in about 4 or 5 visits. You'll then, as you continue to use it, it is supplementary, so each treatment that you give is additional help each time you use the laser. It will stimulate collagen synthesis, improve the joint mobility, and hopefully there is evidence that tapering meds is a very common outcome. I'll move on to that. So there has been evidence, ideally the best evidence that we got is systemic review of multiple clinical trials. Unfortunately, due to we haven't got the numbers in the veterinary medicine, these are only available in human medicine. We've got a couple of papers there in human medicine showing really good effects in human knee osteoarthritis. So that's something to look. Obviously, some of these older studies are using class 3 rather than class 4 laser, which obviously the results have been a little bit less effective in the class 3 use of laser. It's not as effective because it takes a lot longer for the treatments to be given. There are lab animal studies which show beneficial effects in bone healing models and in a variety of different tissues in vitro. There's no randomised blind control study in vet patients, but the next best is a controlled clinical trial in a naturally occurring disease. So this is one that has come out very recently. There's also we've got available in our Laser for Health journal that is produced by ASA. There is evidence that not only, as in this study, we've got 20 dogs that had photobiomodulation therapy twice a week for 3 weeks and then once a week for 3 weeks. 82% of those in the treatment group had a reduction in the dose of non-steroidal given, compared to 0 in the group that had sham treatment. And there was an improvement in lameness score, and there was a reduction in Helsinki score. The other recent study that's been done, and it's only just been published, that showed, rather than comparing those with or without the laser, it compared laser treatment to carprofen treatment, and the outcomes of the dogs that were given laser compared to the dogs that were given carprofen, there was no significant difference between them. So it is as effective as carprofen at reducing lameness. There's another good background report recently done with a good review of dosing guidelines. So that's another one to put on the list to have a read of if you want to go into more detail with it. So in general, when we start seeing a dog with lameness, obviously there's we want to be looking at it, how it stands, how it's walking into the consult, as well as taking a detailed history from the owner. There is the options there for video analysis. You could do it in practice by just doing sit to stand and seeing if there's difficulties with how they're moving. There's also an argument for questionnaires from the owner as well to try and detail where they are having issues. That can be a little bit of a flag warning. You could send that out on email, say, to a lot of the people who have dogs already on steroidals to see if there's a change. And it's also quite useful to have that prior to treatment, so you can then see if there's what changes that have happened after we started the treatment. In terms of orthopaedic exam, we've got our palpation of the joints for heat, pain, swelling, range of movement, cranial jaw and stifle, flexion extension, particularly looking at sort of neck manipulation and stretching around the treats. It might well, particularly with elbow arthritis, help to ascertain if there is any tension in the muscles around the shoulder or around the front limb, because that's where often you will find trigger points. So going into a little bit more detail about looking at muscular assessment, often we think about muscles being damaged when there's been a direct injury, they've fallen somewhere, and that's often, obviously, if there's a hematoma, it can be a source of pain and fatigue. But also bear in mind, if we have got older animals with concurrent disease like diabetes or Addison's or Cushing's disease, hypothyroidism, all of these can cause effects in muscles in general, causing weakness. There can be inflammatory causes as well. So we do have to take these into account, with more dogs being on raw diets or possibly not as balanced as they should be. We should think about taurine deficiency and those sorts of nutritional issues. But in general, I think myofascial trigger points, NTPs for short, they are underdiagnosed in veterinary practice, and they can be often a significant cause of pain, even when we've got improvement once if the joint has been a joint flare, and then that pain has settled down again around the joint. So the way we look for them is either with a pincer grip. We can pinch the muscle between our fingers and sometimes feel a little bit of a nodule there. A trigger point will be a hyper-irritable spot within a taut band in skeletal muscle. The other way of identifying it is with a flat palpation, with a flat palm. You can sometimes compress this against a bone, so particularly over the scapula where you've got those flat muscles, you might well feel a little bit of a blip within the muscle. If the owner is present, or obviously just to be aware, the handler, it might well be that the dog will then jump and react to that. So you can also diagnose them with that they might cry out because that area of the muscle is very painful. You might also notice it with motor issues, so the muscle on that side will be a lot weaker than it was when on the other side, and just identify that as that different from a cramping type of injury to the muscle. A cramp tends to affect the whole muscle, whereas the trigger point will just be within that small little area where it's weak. You could also get autonomic problems, and you can recognise it that way by looking at the limb in general is weaker, both in flexion and extension, because you've got inhibition of the reciprocal muscles due to to what's happening at the level of the trigger points. There's some other papers there to just look at that in a little bit more detail as well. So these are the commonest areas where you tend to get trigger points in the forelimb. It'll be the infraspinatus, quite deep behind the shoulder, the biceps brachii, and then the different areas in the muscle of the triceps. It will be, obviously this is more on the chest wall, it will be up around here within the triceps where the issue will be. So why do they occur? We've got a case of overuse and overload of the muscle, normally because of compensation for pain or trying to avoid pain of moving a joint. You've got decreased ATP, and then the calcium pump that's ATP dependent will cause increased calcium concentration, and contractile activity remains increased. So these are the areas that the laser has been shown that it helps. So you've got an increase of ATP, which helps the sensitivity of ATP and ATP binding proteins to optimize the calcium-potassium pump functions. You've got an increase of protein PP1 and phosphatase activity, so that modulates the glycogen metabolism and the contraction relaxation processes. You've also got increased levels of MyoD proteins regulating myogenesis and mediating the construction of muscle fibres. You've also got, as we touched on before, increase in anti-inflammatory proteins, and that helps to reduce negative feedback of the pro-inflammatory interleukins. And there's evidence that it will reduce pain perception thresholds because of the effect on liver function. So what will the dog look like? Obviously, this is an example of pain coming from the hind limb and then leading to overload and stress of the paralumbar muscles because of the pain associated with hip. It's just easier to see in this picture, but you might well get muscles here with fall-in lameness becoming very tense and overused. So the mechanical stresses cause the chronic muscle overload, and what happens is, instead of the paralumbar vessels on the back helping with just stance and stability, they actually start helping the hind limb move forward, because the muscles of the hind limb are not working as they should do, and that leads to this classic stance of kyphosis. So to summarise, the trigger points lead to a muscular tension with an increased pain and further muscle spasm as the tissue hypoxia increases. So the MLS laser will act in a number of ways to help that tissue hypoxia, reducing swelling, increasing microcirculation, helping with oxygenation of the tissues, and decreasing COX-2 anti-inflammatories. So there are a number of different ways of treating trigger points in physiotherapy in humans. They can use a number of different techniques. So you may have heard of TENS and therapeutic ultrasound. You can simply just massage them with finger pressure, but this tends to be a very painful procedure in itself. What's great about the laser is that it tends to just be a relaxing, it's actually not just releasing the pain, but it's actually a pleasant treatment to have as well. There's been a study comparing the use of laser and dry needling, which is like acupuncture needling, but actually in the location of the trigger point. And that's shown that there's a significant decrease of rest and activity, and an increased pain threshold in the laser group compared to both the other groups. So we'll move on to practical treatment using the MLS laser. So initially what you'll do is, after doing your assessment, you'll, if it is an actively painful condition, you'll then treat the trigger points, and you could treat these up to 3 times. Each trigger point up to 3 times. Each treatment is about 20 seconds. So you could go back to that spot if there is an issue later on in the course of treatment, after you've then scanned the whole muscle that might be having some muscle contracture. And then this can be, because you're using scan mode, you can use that in more of a massaging action. And then directly over the joint, you're going to pick both the chronic pain setting in point mode and the chronic inflammation setting. So each one of those will be in the region. This will be about 4 minutes, and this will be about 4 minutes. So in total, treatment time will probably be in the region of about 10 to 15 minutes. These are the locations. There are dots indicating where you want to be treating them on the inside and the outside of the elbow. But I just encourage you to try and think about it rather than the lateral side or the medial side. You want to be treating the whole joint around the area affected. So when you're treating the elbow, try and also move the joint itself. So you'll flex the joint so that you try and get the laser effect going into all facets of the joint around, so that it can get the maximum surface area. You do want to be aware that you want to reduce the intensity to 50% if there are implants present. In general, the setup is about 4 joules per centimetre squared, which when you're treating them for chronic pain and then chronic inflammation is up to about 8 joules per centimetre squared for each joint. The study we looked at previously has gone up to 20 joules per centimetre squared. So certainly if there is a lot of swelling within the joint, sometimes you do need to increase that dose a little bit more, or if it's a particularly thickened elbow in a Labrador, you might want to go up to those higher levels. So hopefully you can see the areas there that you're going to be treating on the elbow. You want to initially, if it's a acutely painful condition, you want to really treat those every 2 or 3 days if you can. I wouldn't worry too much if, especially at the moment, you are limited to perhaps once a week. I've had really good effects in a dog with hip problems, where we were only able to see, because of the commitments the owner had, only had to see the dog once a week, but we did that for 3 weeks, and then I think it was 6 weeks until I needed to see him again. Twice a week for 2 weeks is standard, and then once a week, and once you've got control of the painful episode, you can then start introducing your exercise program, possibly hydrotherapy. It's probably sensible not to do hydrotherapy on the same day when you first introduce the laser, but I do know that you can use it on a wet coat. So sometimes we've actually got a hydrotherapy ball here, and we'll use the dog might have some hydrotherapy and then have laser afterwards to help to after the before they go home. You do have to just be aware that sometimes they feel so much better that when the owner then lets them off the lead and they run around, 2 or 3 days later, the pain-killing effect, certainly around the trigger points of the muscles, might wear off. So just warn the owner not to, for the dog to overdo it and injure itself anywhere else. Just another note on implants. If there is implants present, you want to try and direct the probe away from those implants. Not because it's going to do any harm to the implants, although they'll overheat, but more the soft tissue overlying it will receive an increased dose. So that's why you tend to reduce the intensity by 50%. So long-term management of arthritis with MLS laser for a non-painful condition. Again, you want to assess the whole dog, and if there's any pain within the muscle or any contracture there, or any trigger points present. You'll tend to do these weekly or fortnightly, and instead of the pain or chronic or acute pain, you'll tend to use arthrosis setting on these dogs. So again, you want to flex and extend the joint as much as you can when you're delivering the laser, and reducing the intensity if there are implants. Just a quick note on using the laser after surgery. This could be for stifle surgery as well as arthroscopy. There is an option to use the intraoral head. So you tend to put that on acute gingival setting, and these tend to be very short. So we've got, you know, 5 seconds here, but you'd increase it so that the joules per centimetre squared would be up to 1 joule per centimetre squared. And you can actually use that intraoperatively with the head there, just after you close the joint capsule, directly over the elbow. But then standard treatment afterwards would be, after we've got hemostasis, because of the effects it can have on angiogenesis, we want to wait for hemostasis before we use the laser, but this can be in the recovery phase before the dog has gone out to the toilet after surgery. You can use edema setting on the machine in scan mode over the joints and all of the soft tissues that it's affected. And then you can also use the laser in the acute pain scan mode to help with postoperative pain, to help reduce any postoperative pain associated with the procedure. And then usually every 2 to 3 days postoperatively, you'll notice it will really help with any, if you're getting any edema after surgery, the laser can be really effective at reducing the swelling. So this was a dog I was treating at the clinic recently, but we'll move on to the practical demonstration now. Unless anyone has any questions, I will just go and get my Rosie, our dog. I will, unfortunately, because I'm going to be having another member of staff helping me, I will have to put my mask on while Rose is in the room, so I hope it won't interfere with anyone being able to hear me. And what I'll do for a moment is I'll just show you here. So we've got the screen here. So when you're on Zoom, we'll go back here. And I just wanted to show you here where we've got the trigger point setting just here. And then when we press start, it would be ready to go straight away. And then what you would do is press the little red button on the end of the laser, on the laser head, and that will count down. And the beauty of that is that instead of, if you've got more than one trigger point to treat on each side of the body, or you want to treat it a second time, once we've had that countdown, instead of it going back to the home screen, like most of the other treatments, it will actually reset itself so it's ready to go next time. If you do want to go back and treat, getting ready first aid clinic information, you'll put that on point mode and then you'll start again. It will set itself up being ready to start, and then you do have to then remember to press the button on the laser head itself. So we'll go get Rosie. And there's some glasses. Just change this around here. There we go. As if by magic, Rosie is now here on our table. So first of all, what we do is obviously we'd see how she was moving through the clinic, and then we'd make an assessment, having a feel all around her shoulders, all around the front of her elbows here. We know that Rosie hasn't actually got arthritis, but we're going to be showing you how to assess the joint. We'd actually look around here. She has actually got some muscle tension behind here. So you never know whether she is actually very early stages, or she's just overdone it in the heart. So first of all, we find, as I showed you, to getting on the trigger points on these areas, and then what we do is take the probe and actually just put those directly over the area to be treated. So it's just here where she's got a very thickened area. So we'll get that set up for a trigger point. And normally what you can do is actually feel the muscle relaxing. They can sometimes, when you first put the probe on, just be a little bit sensitive. So you can then sometimes just pause it briefly, maybe just flex and extend the muscle itself with the joints, just to relax everything. And then sometimes you have to stop that and go back another time, or after some of the treatment. And then you'll use the trigger point setting as well, just to gently hold that in place. So moving along to the actually treating the elbow. We'll then go back here. And so we were doing a dog that we'd seen before with chronic issues, not painful at the moment. We'd use the arthrosis setting here. In point mode, you can see how much quicker. We've got about 6 minutes, 6.5 minutes to use scan mode, whereas if we're using point mode, then it shortens the time delivery to about 2.5 minutes for this size of dog. We can increase the number of points or the area treated, and you can see how that will increase the amount of laser that we're delivering. So go here and start. And then what we do is then press start and then use all around the joint. You tend to have one fixed spot, and you can then move, keep the head in the same place and move that around, just so it's treating all areas of the joint. You then do that over 6 different points of the elbow. And while you're doing that, with a small dog it is easier on a table, but sometimes if they're bigger dogs, then you can have them lying down. So anywhere where, and if they're lying down, then you find that you can flex and extend the joint a lot more easily. What is sometimes difficult is treating the inside of the joint. So sometimes I'll move position and come to the front of the leg and do it like this again, lying down. It's basically keeping everyone comfortable and somewhere where it can be done very nice and easily. So sometimes I'll treat the joint at that point, and then I'll go back to the muscle. If you are using the laser to treat any muscle contracture, then there's a setting for that as well. So just here. Often the changes that we see, you've still got the area that we're looking here, which is basically joules per centimetre squared. That's the total dose of laser that we're delivering. What tends to change is the frequency that the pulses are being delivered. If you find you've got a very chronic case that after 2 or 3 sessions isn't really improving as you'd expect it to, you can actually click on here, CPW, and that actually allows us to use a continued, rather than both of the pulses being frequent, one of them is continuous. And you can see how that increases the amount of the laser you're delivering. So on muscle contracture, I'll tend to use a scan mode. So the timing will be about 5 minutes. And then what we'll do is you can then use that in a slowly massaging action. What's that, Rosie? So you can either use it up and down, General movement comes around. Or you can use it in general circular movements around. You want to use a technique where you're not going to just be randomly moving the probe. You want to be doing it in a way that you're not going to miss any part of the muscle. And if you do find that there's an area that's particularly painful, then you can move away from it. Maybe massage that with your other hand. Again, you can sort of move and flex to keep the muscle relaxed and help with any circulation. And then again, go back to that area. Yeah, this is definitely getting much more comfortable now, isn't it? Right. So I think that's everything. Thank you. Thank you.
Fantastic. Thank you, Caroline. Have you got anything else, or shall I open the...
Yeah, if there's any questions from people.
There's one come through whilst you're demonstrating. Someone says that they've been told it would be 6 to 8 weeks of twice weekly treatment for elbow dysplasia. Is that realistic, or actually would, you know, because you said you should be able to see an improvement within about 6 treatments?
I think it really depends on how long-standing the condition is, and if you're early on in the course of treatment, I think you can combine it. Often, you know, radiographic change doesn't always coincide with the severity of pain, so you've got to do it a little bit of a balance of what works, what is in front of you and what works. I think that's where the questionnaires can really come in use, because you can email them out. It's a progress for the owner, but also that they can, if before that they were struggling up, you know, they could get halfway up the stairs and then they needed a bit of help with the other half. Those are the sorts of things that they can see as an actual difference in. And if we're getting, you know, they can now walk for, you know, with the other dog in the household for 40 minutes, whereas before they were only doing 10 or 15 minutes, then those are the sorts of things that can guide you in how long to continue treatment. Often what I find is that it is so effective that I'm giving owners an idea of twice weekly treatments for, you know, 2 or 3 weeks, but after a week they say, oh no, he's doing much better now, just wants to come in once a week, and that's fine if that works for them. If it's working for the dog, then that's really not a problem. I think the difficulty with feline owners is cat owners is that they're obviously quite reluctant to bring their cat in sometimes anyway, especially if they're getting older. But when they see that it is non-invasive, and it's obviously, certainly if they're have had problems with non-steroidal, we've got very limited options in cats for long-term medication. So if they have had problems with that, then that is if they wanted to do it every 2 weeks, then that might actually be, it wouldn't be enough to put me off recommending it if they don't want to come in quite as frequently.
Okay, and if you've got, say, really advanced elbow dysplasia, obviously there's a lot of bony changes that would limit the ability of the laser to get into the joint. Does that also affect the efficacy of it, I suppose, or, you know, how many treatments you'd need, or?
Well, there has obviously, even though the bone is there on X-rays, it's not a static change. You know, there's still, you know, cartilage around those areas, and hopefully you can reduce the swelling and the pain associated. Obviously, once the cartilage is completely eroded, it's not going to come back.
Yeah.
But you can hopefully stimulate those chondrocytes to, and it's going to have more of an effect than in a local area to reduce COX-2 pathway than just upping the dose of the non-steroidal.